the other way that I look at it, is that it is a BS diagnosis because it's a label, but we're not actually going beyond that. We're not getting to the why. Why are you having these bowel changes? Why are you having this abdominal pain? Why are you having this bloating? Like what is going on to cause that?
What's up, ladies? Welcome to the Health Class She Deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I'm your host, Autumn Paone, and today we are talking to Lola MacLean. Lola is a functional gut health consultant and family nurse practitioner who helps high-achieving women overcome bloating, constipation, and fatigue through a root cause functional medicine approach. She founded Halen Empowered to make gut healing simple, sustainable, and truly effective, so women can finally feel good in their bodies again. Lola, welcome to class.
Thanks so much for having me.
Thank you for being here. I would love to talk about how you got into this work. Let's start there and talk about your history, your own health struggles.
Yeah, well, so definitely it has been a long journey. I have always been super interested in like health and wellness. And when I was little, I was like, oh, I'm going to grow up and be a doctor. And, I got into kind of the real world and realized I didn't want to be a physician. There was a lot there. And so I went to nurse practitioner school and ended up working in primary care for a good 7 years. And during that time, like, my own health issues were kind of like in the background, just kind of dealt with it, right? Like anxiety, I had been diagnosed with IBS, so it just kind of like it was a thing, just left it, whatever. But as I like grew in my practice and like seeing patients over and over again, a really common complaint was always the digestive issues. And then definitely from women, always hormone related, right? Like whether it was heavy cycles or issues with fertility or going through perimenopause or like the postmenopausal years. And those two categories, I felt helpless with what I had as far as my knowledge base, right? Like it was always like, well, I can refer you to GI. Here's a low FODMAP handout, or it's just your hormones. Like, go see the OBGYN. I don't know. Here's birth control, like all the things that now I'm like, why did I do this? Right. And so then, like 2020, I had my daughter and all of my health stuff kind of like came to a head. And at that point, I was like, that moment in time where I was like, okay, I can either go down the road that I already know and I know nothing's going to get solved and I'm just going to be given, a medication for my IBS. I'm going to be given birth control again. Like all these things are not going to get fixed. Or I can go a different road. And that's when I really found functional medicine and dove into that and complete night and day. And so that's kind of how it got
Wow.
started.
Yeah, that's amazing. Well, and I think that the word helpless is so relatable for so many people, women especially, when it
Mhm.
comes to healthcare. It's like you feel helpless because you're like, I don't know what to do. I'm not getting any answers. And then a lot of times the providers also feel helpless because
Yes.
the education's just not there. Yeah. And so, like you said, you're just like, I'm giving this same thing out over and over again, or a referral and a low FODMAP
Mhm.
handout, and I don't know
Nothing
what
is
else to tell.
changing. Yeah.
Yeah.
Yeah, and I think, like, being in that provider role, sometimes, like, we have to put on this face of, like, "Well, I'm the expert, so I know what I'm doing," and even, like, you're like, "I've seen this so many times and nothing gets better, and I don't understand why. Like, why is this not working?" And then we just kinda stop there, right?
Mhm.
Yeah.
Yeah. Yeah, and I guess you can't really say that to a patient of
No,
like,
you can't.
although I always say
I mean, maybe
I
you could.
always
It depends on the person,
yeah,
but
right. I know. I always say that I think that more humility in medical professions, and I feel it more like at the doctor level especially, is at least where I've run into the I don't even know if arrogance is the right word. I feel like they truly do believe sometimes they know what they're saying when it comes to like the it's just your hormones situation. And me knowing what I know now and having an endometriosis diagnosis on the other side of all of it, I'm like, just a little humility for a doctor to look at me and say, hey, I'm not really sure why you're experiencing all of this, but let's see what we can do to figure it out. Instead of
yeah.
like, Yeah, you're just suffering from womanhood. Let me
Yeah,
just
it's just endometriosis. This is what it is. Like, here,
Mhm. Yeah,
we have
yeah.
a solution for it. Here's birth control and go see the OBGYN and
Mhm.
go get an ablation or whatever it is.
Right, yeah, just, like, unhelpful advice after unhelpful advice.
Yeah, yeah,
Yeah.
and that's a big one too, like, the gallbladder was something that I'd always see people be like, "Oh, well, I just got my gallbladder out," and then it's like, now here's all these host of issues that happen. It's like, why did we do that?
Mhm, mhm. So yeah, a lot of your work centers around IBS
Yeah,
specifically. So I'd love to talk about what is IBS. I think it's thrown around a lot. There's a lot of online it almost became a fad to, like, have stomach issues, like the hot girls have stomach problems
yeah.
thing and all that. So what is IBS actually?
Yes. So IBS really is there's a few ways to look at it. One is it is a functional diagnosis in the sense of when we go through and we look at things lab wise, colonoscopy wise, like all of the things that we have in conventional allopathic medicine and we take a look, everything is normal, right? So there's not a whole lot of inflammation present. There's not a cancer. There's not an inflammatory bowel disease. There's not a gastritis. Like there's not these structural issues that are going on, right? So it's a functional disorder. And then technically, the way that it gets diagnosed is we use this criteria called the Rome 4 criteria, and so you have to have recurrent abdominal pain 1 day per week in the last 3 months. And it's linked to either pooping. So you get pain with pooping, or pain is relieved when you poop, or you have a change in like constipation, diarrhea over those 3 months, right? So it's pretty vague and very general. And a lot of people fit it without it actually, being a thing. But that's where it is. It's just a label, right? It's a label that you don't have this structural issue. You meet these specific criteria. We don't know what it is. IBS, right? Irritable bowel
Mhm,
syndrome. The other way that I look at it, is that it is a BS diagnosis because it's a label, but we're not actually going beyond that. We're not getting to the why. Why are you having these bowel changes? Why are you having this abdominal pain? Why are you having this bloating? Like, what is going on to cause that?
mhm. Yeah, yeah, and I think a lot of people kinda run into that where it's more of like a placeholder, I guess, of like yeah, it's not the structural issues like you said, there's nothing, like, crazy life-threatening going on, so here's this sort of vague label
Mhm,
now.
mhm,
And then I think the other thing that we run into a lot with the traditional, like, Western model is, "Okay, what now?"
mhm.
So, yeah, so can you talk to us a little bit about, like, if somebody's going through the more, like, Western, um, medical
Conventional approach?
system, yeah,
Yeah.
what they would be told versus how you approach it now?
So, generally speaking, if you have been given a diagnosis of IBS, it's coming from the gastroenterologist or possibly your primary care provider. And with that, what they'll do is they'll do more like symptom management. And so that's okay, you're having diarrhea. Why don't we take an anti-diarrheal medication? Or you're having constipation. Why don't we take a medication to help you poop on a more regular basis? Low FODMAP is a specific diet that a lot of providers will throw out for IBS. And that's really targeting fermentable sugars that different foods have. And so that helps to relieve bloating. And there's a big reason why low FODMAP tends to help people with IBS, but it's not because it's IBS. And we can talk more about that. But other than that, that's really it. It's like, here's a medication to help the symptom, not going upstream and asking that why question. And that's where I think functional medicine really differs.
Mhm. Yeah. Absolutely, and I think that we run into that with a lot of different even beyond IBS, I think the lack of investigative care of like, "Okay, this is happening, why?"
Mhm.
Continuing to ask why until you get a satisfactory answer. So, now you dove into functional medicine, you saw these kinda gaps and were feeling helpless like we talked about. So, now how do you approach IBS? And if somebody comes to you with all these symptoms, what's different about your approach?
Yeah, and I think that big part, that why, and it's really understanding that everybody's body is very unique. And so it's like, why is this showing up in this person? Not just like, oh, why is there bloating? Oh, it's because X, Y, and Z. But it's why in this unique individual? What is it about their life? What is it about their choices? What is it about their diet, their sleep, their habits? What is it about their environment that's creating their body to show this, to express this, because that's the only way that our body can speak to us is through these symptoms that we have, right? Or lack of symptoms, right? So with that, it's more of that, I do use functional testing, which tends to be a little bit different than conventional testing. So great, you had a colonoscopy, no inflammation, everything looked normal, tissues looked healthy. Maybe you had a stool test that looked for ova and parasites and maybe some like really pathogenic bacteria. But then there's different functional tests that will look at the actual microbiome itself. So, what are your good bacteria looking like? Do you have any like inflammatory, opportunistic bacteria that are usually there that don't get picked up on a conventional test? How is your digestion functioning, right? Those kinds of things. So we can dig deeper there.
And I hear that a lot from functional practitioners that it's really the testing is key, looking at those functional ranges as opposed to
Mhm.
just because, yeah, Western medicine is designed to save lives in more extreme situations, right? And that's amazing and necessary. But when it comes to these more chronic issues, especially things that women are dealing with more often,
Mhm.
it's just a little bit more neglected. I would love to because IBS is more common in women,
Yeah.
correct?
Yeah, absolutely.
Is that uh like social or anatomical or both? Like, do you have any insight on that?
So, when we're thinking about IBS being more common in women, there's a lot that goes into it, right? And it kind of connects back to that microbiome being an environment of itself. So, when I say microbiome, that's all the different like bacteria and yeast and all the different things that live within us naturally. And women and men do have different microbiomes. And a lot of that comes back to our hormones and how we excrete or detoxify our hormones, right? And we have higher levels of estrogen. So that changes the way that our microbiome looks. And if there's changes with that estrogen, that can create changes within our microbiome too. So there's that. I think the other piece too, because a lot of people with IBS also tend to have anxiety, depression, some of those mood disorders. And it's kind of that, well, which is first, chicken or the egg, right? Is it you have
Mhm.
IBS because you have depression and anxiety? And so that mindset has now created this change within your gut? Or did you have a change within your microbiome and within the like intestinal permeability that has now created this state that you're feeling anxious and depressed, right? So
Mhm.
that's a really good question.
Yeah, well, and I'm glad you brought up that part as well with the mental health because something that a lot of women struggle with is being told that their symptoms are psychosomatic. And like obviously your mental state affects your physical state in a very like intimate way. Like they're very intimately connected, but at the
Vice
same time that
versa.
doesn't exactly, yeah, at the same time it doesn't mean that there's not a physical issue going on or something that can be addressed more like physiologically. So do you have advice for somebody who maybe is struggling with the classic, like, bloating, pain with bowel movements, etcetera, and they've just been told so many times, "Oh, you're just anxious. Here, take this antidepressant," whatever it is. Do you have advice for somebody who's like, "I feel like I need to, like, push for a second opinion, or I need more answers here?"
Yeah, absolutely. I mean, that was me, number one. And then also, actually, one of my clients yesterday, we're like kind of coming to the end of our work together. And she was like, I am so glad that we're working because all like this past decade, everybody's been telling me you just need to take an antidepressant to fix this. And you're the only one that's listened and has actually gotten to the root of this. And now she's pooping just fine, doesn't have any anxiety. Like it's all fine and same. And so it's like, if you know that if you have an inkling that there's something else, right? Like go get a second opinion or maybe join that woo-woo functional medicine side of things, like there are alternatives, right? We don't have to be told or given kind of what we do get given in conventional medicine, if that makes sense.
Mhm. Yeah, yeah, there's other options, right?
There are a lot of other options. And I think, right now we're in that weird space where it's like, okay, well, insurance doesn't cover it, or, I don't know how to find this kind of provider in my space, or where do I go about finding these people? We're out there, right?
Right, exactly. And I think also with the powers of social media now, like, there's obviously so many good things and bad things that come with it, but I think one of the good things is just the connectivity, and you can hear other people sharing their stories of like, "Oh, I worked with this functional medicine practitioner and it, like, changed my life," or whatever. And, there's a lot more misinformation out there, but there's also a lot more access to information that you can actually do your own research and figure out where you need to go from there. But I do hear from a lot of people when it comes to those IBS like symptoms and just gut health in general that finding a good functional practitioner is the way to go.
Mhm. Yeah,
That's what I hear.
I really believe it, especially if you have been given a label of IBS,
Mhm.
then, just the way traditional GI works, like, that's it, you're done,
Mhm.
and you still feel awful, and you
Right.
continue to feel awful, and that, like, feeling compounds itself because nothing gets better, and so your mental health starts to suffer, then in turn, your gut gets worse, and then it just, like, it
Mhm.
just keeps going, and one day you
Mhm.
wake up and you're like, "How did I get here? Why is this
Yeah,
happening to me?" You know?
exactly.
Yeah.
Yeah. I'd love to circle back a little bit. You kind of mentioned it, but the link between gut health and hormone health
Mhm.
and how those 2 are very connected. Can you talk a little bit more about that?
Yeah, so there's a couple of ways that I really when I'm thinking about gut and hormones specifically. One way is called the estrobolome, and so that's the part of your microbiome, so those are the specific bacteria that create a enzyme called beta-glucuronidase, right? And they help you to either let estrogen get detoxified and go through your body, or they will cause it to get recirculated, right? So those bacteria kind of decide what happens with your estrogen. Then the other piece with it too is actually your liver and your gallbladder, or if you don't have a gallbladder, just the bile flow itself. Right. Because our liver does that first kind of part with the detoxification of estrogen, right? So it's in your body, you use it, you're gonna clear it out. It goes through the liver to get conjugated, so it gets an escort to get taken out of your body, and it gets put into the bile to go into the gut to get pooped out, right? And so if that those bacteria that create that beta-glucuronidase are pretty abundant in number, that beta-glucuronidase will take away that escort so that estrogen gets recirculated again. It goes back into your system so that way you have it for use. And so sometimes that can create some of those estrogen dominant type symptoms that a lot of people will have, even without their estrogen levels being super high, right? Like you don't have to have high estrogen to be in an estrogen dominant state. It's kind of a balance with estrogen and progesterone and some of the other things too. So that liver health, that bile flow, the microbiome itself, those are all really essential to good hormone balance, right? And how we're getting rid of our estrogen and detoxifying it. Um, yeah,
Mhm.
those are the two primary ways that I think about it.
Yeah, that's really interesting that you say, like, with being in an estrogen dominant state without
Mhm.
necessarily, like, testing for high estrogen.
Mhm.
Because I think that does happen a lot too, where people are like, "Okay, having these problems, they seem hormonal, let me get tested, everything's
Right.
fine."
Mhm. Yeah, I see that a lot in women who have also been diagnosed with PCOS, right? Like
Mm,
they'll be labeled as PCOS kind of just based on this cluster of symptoms, and then they start doing the hormone testing and they're like, "Well, my hormones are fine, but why is this happening?" And then we do a gut test and it's like these particular bacteria are like off the charts and like
mhm,
this is something that's kind of happening and you see it all the time with your cycles and it's just compounding on itself.
mhm. Yeah, absolutely, and I'm curious with, hormonal birth control, like the combo pill especially, like, is that really affecting the estrobolome? Like, do you see really big differences with the guts of women on birth control versus
Control?
not?
Yeah, that's a really good question. So I don't know like specifics with that, but birth control in and of itself, it is known to cause enhanced intestinal permeability, right? So that becomes a driver for changes in our microbiome because we don't have the same environment and different microbes thrive in an environment that is more inflammatory,
Mhm,
if that
mhm.
makes sense. And I think the other big thing, especially with oral contraceptives, is they also deplete vitamin B6, right? And that is something that we really need for a lot of good gut health too. We need it for different enzymes, we need it for bioflow, we need it for just the actual, again, environment of our digestive tract.
So, how then do we take care of the estrobolome?
Yeah. So definitely liver health, bioflow, and anything that creates microbial balance. Those are going to be the good things. And I know, so it's they're kind of the basics and they're not super sexy, right? So it's like
Right.
making sure you get fiber, right? So honestly, being able to have a good 35 grams of fiber a day is really helpful to those beneficial bacteria within our gut. That's the food that they eat, and they need that. Also, that fiber is really anti inflammatory and creates an environment where those good bacteria can thrive. But also, again, kind of like with the bioflow, we need to be eating healthy fats. We need fat to function and we need fat to produce hormones. We need fat to create, that impetus for us to release bile. So low fat diets are something that I'm like, what are you doing? And that's still something I feel like I'm having to scream just because of a lot of the people I work with are like, we were born in the 80s and the 70s and the 60s. And so it's like, okay, low fat, low fat, low fat. It's like, no, no, no. So fat, staying hydrated, that's another really important one too, because we need enough hydration to support that bile flow. So those are kind of like the three big ones that
Mhm,
easy peasy, you can do every day, and that's super supportive of both your gut health and your hormone health.
mhm. Yeah, people became real obsessed with, low fat
Yeah,
everything, and it's
90s, 2000s.
right.
Yeah.
Yeah, the fats are so necessary, and there's so many sources of, like, good healthy fats.
Mhm.
Obviously, you don't wanna be getting them all from your deep fried french fries, but yeah,
But olive
it's
oil, avocados, nuts and seeds, all those wonderful things, right?
mhm.
Yeah.
Yeah, and I think a lot of people automatically just kind of they want the easiest way, so they want somebody to be like, "Okay, just eat these things." Like, they're looking for just the path of least resistance of,
Mhm.
like, I don't wanna do the food diaries and figure out what works for me, I just, like, want a diet, but
Mhm.
you're not very you don't support these, like, super restrictive diets, right?
Yeah, I am not a fan of restriction. I am
Mhm,
very much more into, like, the what can we add? What can we add? What can we add? Because that diversity within our palate also creates a diversity within our microbiome. And the more diverse our gut microbiome is, just overall, the better our health, right? Like
mhm,
there's so much evidence out there to support that. And especially over the past decade, like just the amount of research that has been going on specifically about the microbiome and then its links with all our other aspects of health and like chronic disease. So like cardiovascular health, metabolic health, hormonal health, mental health, things like Alzheimer's, Parkinson's, all of those kinds of things, and how it's tied to the state of our gut microbiome is, I don't know, outstanding. But
mhm,
yeah,
mhm.
just the more that we can add and support rather than take away and restrict.
Yeah, and I love that mindset because I think it gives a lot of freedom for a lot of people, as much as I know, like, the temptation of, like, "Just tell me what to do." It is definitely much more, like, liberating
Hmm.
to be able to be like to just listen to your body, right? To just be like, "Okay, I'm craving this in this moment."
Hmm.
That sure, maybe it's not the healthiest option I could make right now, but, like, I'm meeting myself where I'm at, right?
Mhm.
But I love how you mentioned also all the links with the gut health and everything, because when I was in college, that was something that I researched a lot, was the gut microbiome and linked its links to neurodegenerative diseases
Yeah.
such as Alzheimer's, Parkinson's, and it really is, I mean, like, it's such a baby in the grand scheme of research
Yeah.
because all, like, the new technology and stuff, but it's really interesting the things that are coming out, and when you look at the more lifestyle longitudinal data that's
Mhm.
not, as robust as some other data, but still, it's the diets, quote unquote, that you see the most the healthiest nervous systems with later in life are these diets with, like, just so much fiber, so much
Mhm.
diversity, and it's not they don't cut out carbs, they don't cut out fats, they just eat.
Yeah,
They
and
eat
I
real
think there's
food.
yeah, there's so much there on a couple of levels, right? Because it is very much like not only what you're eating, but also the environment in which you're eating. Are
Mhm.
you eating like rushed out at your desk on the go? Like, yeah, you can be eating the healthiest, you know, salad and still have bloating and constipation, but you can sit down and you can eat, a heavier meal and it be within the company of friends and family, and you're laughing and enjoying and have none of those issues, right? Like
Mhm.
that environment is just as important as the actual tangible stuff we're putting into our body.
Yeah, and I love how you bring that up because I'm so guilty of that, of, like, I wanna watch TV. I wanna watch TV while I'm eating. It's such, like, a terrible habit I, picked up in college because it's just you're in between classes, you're busy, you
Yeah.
have a million things going on, you're like, "I just wanna lay in bed and watch my show and eat my food and rest
Mhm.
for 20 minutes before I have to run to the next thing." And it's so I do notice such a difference, though, in, like, the more, like, communal, like, especially with the holidays just
Yeah.
passing, like, all the food that you eat when you're in community, it feels different, right? The
Mhm.
state your body is in is very important, so I love how you bring that up.
Yeah.
So, I wanted to ask, just as a little aside here with the IBS stuff, just because I am in the endometriosis space, and I know a lot of people, like, come from my, TikTok and listen to the show, because a lot of women with endo and pelvic pain are misdiagnosed with IBS, or maybe just it's again going back to
Oh.
that not asking why. Right, yeah, of, like, not being like, "Why do I have IBS?" Because,
Mhm.
endo's gluing my gut up or my intestines to something
To
else or whatever,
itself.
so yeah, so I'm curious if you know, or if you've noticed any red flags or signs that somebody's body is telling them, like, "Hey, it's not just IBS. We need to
Mhm.
dive more into this."
Yeah, so again, that goes back to that why in this unique individual, right?
Mhm.
And like to that point, one of my favorite clients, she had endometriosis and well, she has endometriosis and IBS, right? And there was a lot of back and forth about like, well, is it this that's causing my symptoms or is it this that's causing my symptoms? And so a lot of the work that we did was actually like, well, why can't it be both? And when this symptom is arising, like what is that telling like what is your body telling you with that particular thing? And a lot of it was coming back to inflammation for her, right? And so what we worked on a lot was we did a little bit of an elimination diet to take away some very specific food triggers for her. And over time, we were able to reintroduce those back in, but also it was like adding in that fiber component again, really working on some very low anti inflammatory practices with like peppermint and doing massage stuff and castor oil and like really like taking some time to herself because she was in a very, like, stressful situation too. So kinda working on all those pieces together, we really fixed kinda what was going on with the bowels. Like, yes, she still has endometriosis, and yes, she still has flares. With that, they're significantly less because that inflammation within the gut has really driven stuff down, right? But it's kinda you have to work on both at the same time. It can't just be one or the other, right? And
Right.
definitely with, like, more of that functional testing, there's pretty clear pictures that pop up where it's like, "Oh, there's" like, yes, you have some stuff going on with in the digestive tract, but also based on these different patterns, there's a likelihood that there's something outside of this going on, right? So do we need to do, like, a Dutch test, or do we need to do some other type of testing to dive further that way. It's
Mhm.
kinda like having that open, what is it people call it? Beginner's mindset, right? Where there's, like, that openness to curiosity, and it doesn't have to be this one way. You have both, so let's explore the realms of both.
Yeah.
Yeah.
That's like a very that's like true holism, right? You're
Mhm.
looking at
Mhm.
everything.
Yeah.
Yeah, instead of just reducing, because I think we do tend to do that a lot. We just reduce symptoms and we try to box everything, and that's
It
something.
makes it easy, right? Where you're like, "Oh, here's
Mhm.
the thing, let me fix this." But
Mhm.
also, like, we do have to remember that all the individual pieces are greater than the whole,
Yes.
right? You know, it's
Yeah.
not that reductionist, but that, like, we do really need to take a step back and look at the whole picture. And
Yeah.
which pieces do we pull that make the most difference?
Right. Exactly. And I think also when it comes to the gut specifically, people understandably jumped to diet. They're like, "Oh,
Mhm.
what can I do with my diet?" Which is great. There's obviously always some improvements that can be had there, but there's so many other lifestyle factors, and like we were talking with the psychosomatic stuff, your mental health affecting your gut health. There are just so many different, like you said, you have to look at the entire body, the entire environment as this one picture to really address the problem. And I
Yeah.
do think, yeah, that's something that I've, had to, I feel like I thought I knew it. And that, like, with the endo diagnosis, it's like that whole, because you just have all these like little things where you're like, is this the endo or is it
Or is it
something
something
else?
else?
Yeah. And you really have to take that full body approach.
Mhm. Yeah.
So,
And that's where
yeah.
it's like that too, that like, okay, well, I know that this exists. Let me kind of run through my routines and my normal and my patterns. And was there anything different? Or has everything been the same, but now this is popping up? So could it could we explore that? Could that be something else that my body is trying to tell me, right?
Hmm.
And yes, diet is important. I don't want to say like what you put in your mouth doesn't matter because it absolutely does.
Right.
But at that same time, it's also all of the other things. So it's the terrain. Do I have good digestive enzymes? Do I have enough production of stomach acid and bile and pancreatic enzymes? Do I have a healthy microbiome that's supportive? Is there a lot of inflammation going on within my gut? What is it? 70% of our immune system also is within our gut. So
Mm.
any inflammation is going to start to trigger immune reactions to things. And when we have that enhanced intestinal permeability, we're more reactive to everything. So how is the state of our actual, like, our cells, and are we getting enough cellular hydration to block things? Do we have enough mucus? Do we have enough enzymes to get everything to go through? So it's the terrain, right? It's like a garden is kind of what I tell people. And you need to have healthy soil, you need to have healthy water, you need to have, good plants and some weeds, and we got to kind of work it out.
Mhm. Yeah, and I think, yeah, that's a really great approach. I love your emphasis on the, like, emotional side of things as well, and
Mhm.
the mental side of things, and even the spiritual side of things can be really key to figuring out how you can optimize your health, how you can treat or reduce symptoms or whatever you're trying to do. Yeah, they're all so important. I think anyone who has gone through that type of work or really dove deep into all of those different aspects can attest to the fact that it makes a difference.
Mhm.
It's not like some woo woo thing. I think a lot of people just automatically assume like that sounds that sounds woo, that sounds fake. It doesn't sound scientific. It's like
Mhm.
actually we
There's a
have a lot
lot
of.
of research to back
Yeah.
up a lot of the functional testing and a lot of, like, I mean, that's the other thing too, because I think still, like, in public, sometimes people assume functional medicine is, like, bunk science, and it's like, it's not bunk science, like, it is data driven for a good chunk of things, right? Like,
Mhm.
it's not a bunk thing anymore, like,
Yeah.
enhanced intestinal permeability is a legit thing. When people were talking
Mhm.
about leaky gut 10 years ago, it's like, "What is wrong with you?" Like, now it's like, "No, it's legit, it's legit."
Exactly.
Yeah,
Yeah. And it's, like, common, right? Like, or a lot of people are unknowingly.
walking around, yeah.
Yeah, and it's the root of a lot of things. It's one of those things too where you kinda don't know that that you're missing. I don't even know how to phrase this, but once you go through all that work and you achieve a much more, like, optimal state and you have all this energy and all that, you, like, look back and you're like, "I can't
What was
believe I
I
was."
doing?
Yeah. Like, I can't believe I, like, functioned. How was I getting out
Yeah.
of bed every day? Yeah, so it's can be really transformative for a lot of people, and like you say with the there's, like, so much evidence now.
Mhm.
Chronic stress is one of those big things,
Yeah,
right? That people were talking about
absolutely.
before. People were like, stress isn't gonna kill you," and it's like,
It
"Wait,
absolutely
actually
does.
it is?" Yeah, and
Absolutely does.
I imagine with your clientele, that's probably a big one
Mhm.
also. Is there a way that you sort of guide people through that when you're addressing these other non-food pillars of health? Is there do you have any, like, tips, or is there a specific
Mhm.
protocol for that, or is it very individual?
Yeah, so it is individual, but actually one of, like, the very common themes that I see, because I think just, like, the algorithm has been feeding me this recently, is, like, cortisol face, and so everybody's all about cortisol, right? But actually one of the things that I see very commonly is this pattern of lower cortisol, not like we don't have any and not like our adrenals are falling apart. We don't have adrenal fatigue. That's not a real thing, but just that like lower state, we're suppressed. And so when we're suppressed, we tend to function more in a fight flight mode based on norepinephrine and epinephrine, right? Our cortisol doesn't like come up quite as well. And so when we are, the adrenaline is what gets us through stuff. So a lot of the work that we end up doing is like really backing that, like, how do we bring the adrenaline down, but bring the cortisol up, right? Like, how do we come from this state of just, like, chronic sympathetic overdrive into a more, like, rest, digest, take our time, and it really does come back a lot of times to, like, sitting down for meals, chewing our food thoroughly, like, a lot of those kinds of things. Like, let's just take 30 seconds to take a breath, to check in with ourselves. Let's set a reminder in our phone for, like, 2 p.m. to just check in and, like, have I had water today? How am I feeling? You know, like, actually taking care of ourselves.
Mhm. Yeah, and I think it's so interesting that you say, like, with the cortisol not coming up the way it's supposed to
Mhm,
and looking at adrenaline. I don't hear very many people talking about adrenaline, but
mhm.
is that something that you see commonly?
Yeah, so when we're thinking about like so adrenaline is more like that epinephrine, norepinephrine, those catecholamines. And with the epinephrine and norepinephrine, like if you think about a stress response, they're the immediate gas pedal go, right? Whereas cortisol is more of like a coasting, like it'll get there, okay, now it's going to take over and that's going to be the stress hormone that's circulating primarily. And so the epinephrine and norepinephrine are very much like up and down, like okay, we're done, we're done, we're done, but when we have that lower cortisol space, then that's the primary driver. So, like, you wake up in the morning and you're like, okay, I'm rushed, or like you flip your lid at pretty much anything, or, you know, every little thing will trigger you. You get really irritated and can't figure out why. It's primarily that adrenaline kind of taking over the show.
Interesting. Yeah, that's not what you hear. Cortisol gets so much, so
We
much.
need cortisol. It is so important, especially for hormonal health. Like it's a primer for our estrogen and progesterone receptors, right? So it's like
Mm,
can't have no cortisol. That's ridiculous. But
right. Yeah.
yeah,
Yeah, it's been so demonized. And
I
that's
know.
again
Yeah, I mean, you
like I
absolutely
was
need it. It's an important
right.
thing.
Yeah. Like I was saying with like social media being good and bad, it's like good because it's something that we need to be aware of since we're all kind of chronically stressed, but at the same time, it's bad because now everybody hates cortisol and
Yeah.
cortisol didn't do anything to deserve that.
No,
But
it's your body trying in its infinite wisdom to protect you. You know?
mhm,
Yeah.
exactly. Yeah, but that's really interesting with the adrenaline because not a lot of people will bring that part
Mm.
up.
Mhm.
So thank you for that.
Yeah.
So, we're coming up to the end here, but I'd love to know one small doable step for people to support their gut health this week. I like to leave people with something just very, sustainable, actionable
Mhm.
based on what we've talked about in the episode.
Yeah, I think the one thing that I'm gonna pull is eating hygiene, right? Super easy to do, free, Doesn't take any extra time, but is one of the biggest things that I've seen help reduce bloating and symptoms pretty quickly, just because now we're sitting down to eat our meal. We're in that rest state. We're being present with what is in front of us. So now our mind can start to do the digestive process, right? Because a lot of our digestion actually starts in that cephalic phase. So now our body's thinking, and it's like, oh, let me start making the stomach acid. Let me start releasing that bile. Let me start getting everything primed and ready. And then when we're chewing our food, we don't have to work harder with our digestion. So things move through a little bit easier. There's less pressure, there's less gas, there's less buildup. Things move through a little bit easier. That's the best one I have for people. It's like
Awesome.
it really is a big game changer if you do it. You have to do it though. And it can be so hard. It can be so hard to just like sit there, look at your food, chew it, think about it, but it really is a huge game changer.
Yeah, and especially if you're somebody like me who always is, like, just busy and gets distracted, and
Mhm.
then it's, like, 2 o'clock, and I'm like, "Oh my god, I'm starving," and so then I
Yep.
go down and make something as quick as possible, and I'm, like, snacking while I'm making something, and yeah, it's definitely can be difficult, but I know I have done that before where I, really
Actually, so
make
yeah.
conscious effort, yeah, and it does make a very big difference.
Mhm.
Um, this has been an amazing interview. I do have a question that I like to ask all of my guests at the end. You can take it in any direction. We've talked about a lot of different things. So, if you could rewrite the health class curriculum that every woman deserves, what would your first lesson be?
Ooh, that's a really good question. I think the first lesson would probably be actually listening to your body. Like your body is not the enemy, right? It is trying to talk to you in the only way that it knows how. And rather than sitting there and being like, well, this is a problem I need to fix, and this is a problem I need to fix, and why isn't this working? And demonizing it, if we could just listen and start to ask why. Why is this showing up for me? Why is this happening? Like what can I start to do about it?
Yeah. Yeah,
Yeah.
and that's a very aligned message for this podcast because it's
Mhm.
just one of the main missions is
Mhm.
to get women to really be listening to their bodies and then advocating for it. You can advocate for yourself so much better when you are in tune with
And
what's going on. So,
you know what's going on rather than some
yeah.
external force, or some, not to
Mhm.
say conventional medicine is bad because it's not, but, like your primary sitting there being like, "No, you're crazy." Like, I'm not.
Right.
I know what's
Exactly.
going on with me.
Yeah, exactly. And it's so important because, it could save you years of pain and that emotional aspect of all the gaslighting and
Mhm.
yeah, yeah, that's a really great message. So, thank you so much for being here.
Yeah, thank you.
Yeah, of course. Where can people find you?
Yes, so easiest way is through Instagram at Lola MacLean DNP, and then, um otherwise, my website, which is halenempowered.com, but Instagram's the easiest way to find me, get in touch with me. I like to talk with everybody, so it's just good to have
Awesome.
community.
Great. Absolutely. And I will link all that in the show notes for everybody as well. So you guys can just head there and find Lola's Instagram. Thank you guys so much for listening. This has been an amazing class. I hope you all learned something new. Make sure to rate and review to help me out. Find me on Instagram, TikTok. You can find those in the show notes as well. And class dismissed.